You're listening to a podcast of Health Talk with Dr. Ronald Hoffman from WOR 710 HD New York. Log on to WOR710.com for more information.
Welcome to Health Talk. Dr. Ronald Hoffman here. A special focus subject tonight because we're going to take on a very controversial area in medicine. Tonight's guest is one of America's most innovative yet controversial physicians. The way that he came to my attention is that many years ago in the 1980s, New York Magazine ran an investigative report on back therapies. Apparently, the investigative journalist who was looking into various forms of back therapy had back problems, and he visited a variety of therapists to be found within Manhattan. And he tried a little bit of this. He went to a conventional doctor. He went to alternative practitioners such as acupuncturists, chiropractors. He did Tai Chi. He did Feldenkrais. And he rated the various therapies and basically came to the conclusion that these therapies helped him in various ways, but none of them completely conquered his back problem. But he was somewhat satisfied that at least he was coping with his back problem. A few months later, to my amazement, the cover of New York Magazine was adorned with a bold headline that said, "The answer to back pain," with an exclamation point. And in it, the author divulged that he had discovered a paradigm that completely abolished his back problems. And I read on with fascination. And that's where tonight's guest comes in, because at the time, he had just written a book called Healing Back Pain. And it was a book that revolutionized the world of pain treatment and really set the medical establishment on its ears, got people arguing, created great controversy, and now he's written a great new book called The Divided Mind. And this stuff is very important for you to hear. He is, of course, Dr. John Sarno, world famous as a guy who treats back pain, not with surgery, not with manipulation, injections, but he treats it via a unique mind-body therapy. So it's a great pleasure having you on the program, Dr. Sarno.
Yes, thank you. Good evening.
And I'll additionally mention that Dr. Sarno continues to be a professor of rehabilitation medicine at the New York University School of Medicine right here in Manhattan. He has been practicing medicine since 1950, which is a little bit that's a little before I went to medical school. I wasn't practicing. That was before I was practicing anything. And you were in medicine.
Yeah, I graduated that year.
Okay. So tell us a little bit about how you came to believe that the vast panoply of medicine, the surgery, all the therapies, the physical therapy, the injections, the drugs, really were the wrong way to go in terms of treating back problems.
Yeah, well, you see, it's not really a question of a therapeutic approach. The answer to this is based in the question of diagnosis, not approach. In other words, after working with the usual diagnostic methods and therapeutic techniques for a number of years, I started doing this in 1965 when Dr. Rusk at the famous Rusk Institute asked me to come to the Institute as the head of the outpatient department. And I was confronted with these large number of people with pain, yes, back pain. Actually, these days, I see people with pain in the back, the neck, the shoulders, the arms. It's really musculoskeletal pain. You can have it anywhere.
And you have seen literally thousands and thousands of patients in your medical career.
If you look at the simple numbers, I think since about 1980, I've seen about 500 new patients a year. And so you can see what that adds up to. Actually, it even goes back further than that. At any rate, it's a question of diagnosis, not treatment. The treatment follows the diagnosis. And what's the diagnosis? That these very real pain things, and that's the thing that one has to make absolutely clear, this is real physical pain, is actually initiated by the brain in an attempt to protect people from feelings that are inside and that the brain considers to be very painful, very dangerous, and things of that sort.
Now, ordinarily, when you say that, a lot of people would say, well, Dr. Sarno is accusing us of malingering, of making up symptoms, of trying to get out of, say, work or get on disability or something like that.
From the truth. In all the years that I've been doing this work, I think I can't remember one single person who was truly a malingerer. And so that really isn't in the picture at all. These are people that have had pain in these various locations, and as you mentioned a moment ago, the reporter from New York Magazine had been everywhere and tried everything. Indeed, most of the people that I see these days still have been everywhere and tried everything before somehow or other they've come into contact with this idea. Writing a number of books on the subject has been helpful because people will get to see them, or friends will say, I think you ought to read this and take a look at it, and so on. So a lot of people can be exposed to the idea. No, these are real physical symptoms, and they're based, as I said, on, to make it, very simple, stresses and strains in our lives. And these stresses and strains can produce internal reactions that the brain considers to be, very painful or even very dangerous, like intense anger, for example. I think that's one of the most important things, that we very often are being protected from the intense anger that we have at an unconscious level.
So you're saying that the body creates pain almost to distract us from something that would be more difficult to experience, an experience of tremendous fear or helplessness that may be very primal or childish in origin.
You put it very well. That's exactly what happens.
And so this is actually a type of theory that harkens back to Sigmund Freud, that we block experiences, that we keep them in our unconscious.
Well, yes. One of the interesting things is that, yes, Freud introduced the world of medicine to the unconscious, and indeed he pointed out that many things are repressed and kept in the unconscious. But paradoxically, when confronted with this particular disorder, which he described many, many years ago on two different occasions in the medical literature, he said, no, that's not caused by the brain, that's organic. However, I think the brain is using it for psychological purposes. But even the great Freud, was not aware that these pains are literally brought on by the brain, yes.
Okay, now what if a patient comes to you, as they often do, bearing MRI in hand,
right,
that shows clear-cut evidence,
right,
of a disc herniation,
right,
or some sort of spinal malformation, and they point to it and they say, Doc, this is where they say my nerve is being pinched here,
yes,
I need an operation. Isn't that a clear-cut evidence that the problem is not in the brain, that it's organic, that it's physical, there's actually a cause?
Well, first I should tell you that at least 75% of the people I've seen over these years have come to me with MRIs like that, or X-rays. I started this before MRIs existed.
So it would seem it would be impossible to make them better.
Yeah, but
without...
you see, here's the rub, as our friend Shakespeare said. These structural abnormalities are real, and they are there, but they are not the cause of the pain. This is an enormous misconception in medicine. It is assumed by all the doctors that a herniated disc must be the cause of the pain. Well, I will tell you, Doc, you and I are both physicians. There is no evidence in the medical literature that this is so.
Well, actually, I will echo what you say, because there have been studies where they've given radiologists MRIs of either sufferers of back pain or non-sufferers of back pain,
right,
and they blinded the radiologist to the actual condition of the patient.
Right.
And so they'll pick up a MRI and they'll say, well, this guy is obviously going to be in a lot of pain. I can see it because they have this, this, and this. And then it turns out that the patient is fine, does not have any symptoms at all, and vice versa sometimes.
Well, exactly. And in 1996, a paper was published by a doctor named Maureen Jensen and her colleagues, in which they did MRIs on, I think it was something like 98 patients who had never had back pain in their lives. And she found that only 36% of them had normal discs. the rest of them.
So in other words, if you look for a culprit lesion causing the pain, you will find it even if there's no pain.
Exactly.
All right. Important point. Can you hold that thought? Because
Sure.
we need to get to a break. When we come back, we'll examine further this very controversial notion that we needn't cut nor medicate nor therapeutize nor acupuncture. What we need to do is we need to investigate the source of the problem, which is the mind itself when it comes to a vast array of pain syndromes. That's the message of Dr. John Sarno in his new book, The Divided Mind. I'm Dr. Ronald Hoffman, and this is Health Talk. Back to Health Talk. I'm Dr. Ronald Hoffman. We're talking tonight to Dr. John Sarno. He's an establishment doctor who works in a mainstream rehabilitation hospital, one of the finest in the country, part of New York University here in Manhattan at the Rusk Institute. And his contention is that back surgery, medication for back problems, even alternative therapies like chiropractic, acupuncture, massage, various healing modalities of this kind make absolutely no difference when it comes to healing back pain, and that the key is the mind-body connection. Dr. Sarno, can you illustrate this principle with some cases that you've seen? I mean, there are literally hundreds of cases that you describe in your books, but just give us some examples.
Well, I mean, it's so common and it's so universal that it's, and I see them every day. Someone who comes in with a typical backstory, and back pain that they've had for a while, and it's questioning the patient about what's going on in their lives, and even more important, of how they function. For example, everybody has stresses and strains in his life, and what I find in the vast majority of people that I see is that they tend to expect a great deal of themselves and to put themselves under pressure and to be good people. Mm-hmm. That also is a kind of pressure. See,
I find that really the case often in my migraine patients. Is that a type of pain that is also?
Oh, yeah, sure. Like migraine is one of the things. You talk about back pain, but indeed, in a divided mind, I've gone much, much broader than back pain. It's, first of all, pain of all kinds. First, and secondly, it involves a whole variety of other physical disorders that I think stem from the same basic psychology. The common reflux, for example, or irritable bowel syndrome, the common headaches and migraine, among them, of course, common skin reactions, common allergic reactions. The amazing thing
even is autoimmune reactions you talk about as well.
Oh, yeah, of course, autoimmune disorders, but those are more serious. I'm talking now about the relatively benign ones, and the pain things fall into that category, and all these other things that are virtually universal. We're talking about the human condition. We are all striving to do right and to do well. We all face problems in our lives. And the point is that it's normal for us to have reactions inside to these pressures and problems in our lives. And what has happened that people will get these physical things, and the entire attention is put on the disorder itself. If you've got a stomach problem, you take this medication. If you've got that problem, you take that medication, and so on. And no attention is paid whatsoever to the fact that these things are initiated by the fact that we are human and that we react to things in life and that we have certain tendencies. The great paradox is that trying to do the right thing and trying to be a good person can be one of the most important factors here. I had a lady tonight.
Can make things worse.
Yeah. A lady tonight in a meeting who we said, you want case histories. She was talking about the problems in her family amongst her sisters and so on. And she said, and I try to make everything good. I try to patch up and be the peacemaker. Well, if I tell you that indeed is the major reason why this poor lady has been having back pain, because all of these pressures that she puts on herself actually